Hello, everyone, and welcome to WHIS Talks. WHIS, for those who may not know what it is the World Health Innovation Summit platform. It's a platform to improve health and well-being, share knowledge, and creating an opportunity to better the world we live in. This is a non-profit organization that exists through collaboration and specific pillars targeting relevant points through projects. We're here to create a positive atmosphere that gives responsibilities to businesses and to communities in order to stimulate and facilitate change on local, national, and international level. And tonight I'm from Australia. So tonight here, today over there, I'm so very pleased to host two women that I absolutely adore for their mind, their drive, their leadership in their field. So I'm very pleased to announce that Dr. Christine Sorensen is here. She's the founder of Global Health Literacy Academy. She's based in Denmark. And then Jill Ashen, who is the founder of African United. So the intention is to ask some questions, and of course, participation is absolutely encouraged by anyone really who is following us live stream on either Twitter or LinkedIn or Facebook or through our website. And it is about really the importance of health literacy in the COVID era, as we start now referring to it. The understanding is that health literacy is key to engage people, to clarify directions and informations in a situation where globally there's a whole lot of confusion. And in the absence of vaccine or medications, non-pharmaceutical interventions are still the most important response strategies based on community interventions, such as, for example, person-to-person distancing, mask wearing, isolation, and good personal hygiene, all of which have been demonstrated really they can reduce the impact of this and seemingly unstoppable, globally spreading natural disaster. But health literacy levels can increase people's ability to take action and manage their health care and to promote trust really between community and providers. So I would like to ask both Christine and Michelle to introduce each other, to introduce yourselves rather to the people following us, and then start giving us some comments on coronavirus and strategies to regaining trust and engaging communities. So, Christine, can we start from you and tell us a little bit about yourself and how your work is about this topic of health literacy?
Yeah. Thank you, and hello, Manuela and Michelle and everyone listening to this webinar and podcast. I'm very pleased to be here. My name is Christine Sorensen. I'm based in Denmark, and I have founded the Global Health Literacy Academy. I'm also president of the International Health Literacy Association and honorary professor of ISU University in Taiwan. And for the last 10 years, I've been working in the field of health literacy. And we have seen that this is a growing concern because although we have in many places welfare societies with good educational systems, good healthcare systems, unfortunately we see that we still lose people on the way in the information jungle, and they have problems navigating the complexity of healthcare systems. So this has been a challenge I've been working with, and I'm pleased to be here so we can discuss the consequences in the light of the current pandemic.
Thank you. And Michelle, from your perspective in South Africa, I know you're very much engaged as a founder of the Africans United. How do you see health literacy within the reality of the current issues?
I like what you were saying, Christine, about the information jungle. I think it really, it does sometimes feel like it's a jungle out there, and there's a lot to navigate. And I think the pandemic has raised individual, collective, and global awareness on the importance of our health and health literacy, and where it is that we have access to it, how it is that we have access to it, and actually what's been communicated. From a perspective of mental well-being in Africans United, we're certainly seeing an increase of individuals suffering with anxiety and depression, and this feeling of being so overwhelmed. How do I look after myself? Where do I go? What information do I trust? Who do I trust it from? The ongoing argument around whether or not one should be wearing a mask, that it's even still an ongoing discussion. It boggles my mind. But certainly what we're seeing from South Africa is, we've just gone down into level 2. A lot more economic sectors are opening up, but also there seems to be a sense of complacency. People are not wearing their masks. People are carrying on and socializing as though nothing is going on, as though the pandemic is over. And it begs the question, the role of health literacy, and how much more do we need to participate with our neighbors, with our family, within organizations, in realizing that the compliance that organizations have to put in place in terms of the regulations to the pandemic, it's not just about compliance, that actually these are conversations that relate directly to health literacy. So I think even and individuals and organizations are looking at health literacy needs to be addressed. Because certainly for me, the minute I started to become a lot more aware of the power of health literacy in my own productivity as an employee, as a coach, as a mother, it really does add significant value, not just in the well-being of yourself, but in the communities that you serve and the organizations that you serve. I think we're taking our health literacy for granted and the role that it plays.
Mm-hmm. Right. And it is absolutely right. And do you think, Christine, that the concept itself of health literacy is not quite linear, isn't it? Isn't beyond really the capacity of reading and writing, which, as we know, and this is a generalization, but you would expect that messages put out there by countries in general are relatively easy to be followed. Really, they're not overly complicated. So what it is that it's really discouraged people, then not discourage, but let's say does not encourage people to then follow through. What is it? Is it like a distrust, or our carelessness? Is just a shift of responsibility? How can an improved or different kind of health literacy, what are we looking at in order to resolve this issue?
So looking at the concept of health literacy, people are often confused in the sense that, yes, it's closely related to literacy, where it's about reading and writing and understanding texts. But literacy can also be understood as a sort of life skills. And it's in that context that I tend to look at health literacy. So how literate are we in the terms of health and well-being? And our colleague, Professor Don Nutbeam from Australia, he recommends that we look at it from 3 perspectives. Functional health literacy, which is really, can you read and understand a medical text or a form or a brochure? Can you find it and understand it? And he says also interactive health literacy. Can you engage with the health system, engage with your GP, or engage with family and relatives about your own health or other people's health? And lastly, critical health literacy, which is really about contextualizing health, knowing that those small actions we are asked to do every day in terms of fighting the pandemic has a societal impact. And I fully understand that we see the signs of corona fatigue. People are complacent, they're fed up with all these restrictions. But the big challenge is now to let them understand that they still have a major role to play in keeping the pandemic at a really low level until we also have a vaccine. So we need, their full understanding of why they should keep behaving with social and physical distancing and washing hands and wearing masks, and react if they get some symptoms. Perhaps download the app, the Corona app that many countries developed. Um, and this also helps on many other diseases, because we've probably seen also a bit of a slip in recent years where there's a mindset of fix and repair. If there's something wrong, I just go to the hospital and it's getting fixed. But we just can't afford everyone going to the hospital, because we have so many things that are preventable. So if people were able to take a bit more care of themselves and their families and their communities, we would see a lot of less suffering in the sense, and less budgets going to fix and repair, and we could instead invest in healthy environments and health supporting environments. So these are the challenges that we're dealing with at this point in time. And health literacy is not as a complex concept, but we can also call it competence or health skills or health abilities.
Mm-hmm. And we can also call it skills for self-responsibility, because I think this is really very critical to the whole, probably globally, as we look at it. Michelle, what do you think about this, and what type of response do you see in, as a founder of Africans United? What type do you also have their corona fatigue information, or perhaps worse, misinformation that can create perhaps distrust or lack of adherence to certain rules? What's your view with that?
I think Christine highlighted some very relevant concerns, global concerns, and also some interesting patterns that we're seeing as we start to enter second waves, as we start to enter different seasons. But certainly from an Africans United perspective, so we started coaching circles at the beginning of the pandemic as a way to stay connected and to build community. And to provide support and to engage, so that individuals that are going through a difficult time, we can reinforce the tools, the self-mastery, the mindfulness, and what we're teaching individuals. But what we're prototyping at the moment, which is quite interesting, is looking at nutritional kind of active circles where, I've always been fortunate. I've worked on the Nutrilite brand for a number of years. And, so I was engaged with the former head of the Dietetics Association in South Africa. So I've got a lovely network. I can just pick up the call and I can chat with regards to my nutritional needs, my supplements. If I'm getting medication, I do work with the Value Health Group. So I'm asking Dr. Govender, hey, I took out the package insert of Tamiflu. Providing this level of support certainly provides the kind of support that individuals are needing to navigate. So what is this thing with ginger? What is this thing with how do I eat healthy? How do I boost my immune system? We're certainly seeing that that's helping facilitate a dialogue and a conversation around health literacy. And I'd be keen to see if we could prototype that in other parts of the world and partner with other clinicians and dietitians and doctors who are available, who want to contribute, and to see how technology can help us scale something like this to provide communities and individuals with support.
That's right. So what you're referring to is really is an integrative model of, let's call it patient-centered or person-centered model of healthcare, which then again, it increases knowledge, increases participation, and increases really responsibility at the same time. Is it really possibly where we're moving towards? What do you think, Christine? Do you agree that could improve health literacy in general by that increased participation? Rather than moving really the scope of the old type of medical care, old as in just recently applied, to one that is far more participatory but patient-centered. Is this something we can hope for?
I think we should hope for it, and we have to hope for it in terms of sustainability point of view, that we need everyone to buy in to do their part of investing in their own health, and also let decision makers know if there are things that cannot be done due to structural barriers. On the other hand, we cannot just blame, the people, because they only have the opportunities that are there for them, that we, from a political perspective, have given them. So health literacy also relates to a political choice, where it's a whole of government approach or it takes a whole of a government to design societies where people are allowed to grow and develop their fullest potential with this people-centered foundation, and not only look at things in silos where they have to jump from one island to the other to get into contact with the right authorities. So we need governments to take responsibility and build, from a people-centered approach, opportunities where we can get the populations to buy in according to their specific needs.
Absolutely, great point. And and I guess by doing that, really, there is a cooperation, because let's face it, coronavirus is now, but we don't know whether there are going to be more pandemics in the future, whether there are going to be other issues in the future. So this should be really a great time to, and one day we look back and perhaps troubleshoot all those mistakes that have been made so far. So in that framework, Michelle, what do you think was the perhaps things that, if you had a magic wand, if you said, look, I'm going to change this, right, because to make a better outcome on what's right now regarded as a bit of a hit and miss in regards to management of the coronavirus pandemic, what do you think you would want to do from, like I say, your perspective within the African the foundation that you lead? What would you want to do?
I think for me, it's just the magic wand would be to wake everybody up. It feels as though everybody is sleepwalking. It really feels that way. John Kay and Mervyn King published this book, I think, beginning of the year, Radical Uncertainty, and really talking about managing uncertainty through emergence as opposed to certainty. And I think that the sleepwalking for me is a significant concern, and to wave a magic wand to remind people that the success and failure, whether it be of an organization, an entrepreneur, or government, is going to start and end with our individual health and well-being. The quality of our thinking is determined by the quality of how we're taking care of ourselves, but also the role of, to Christine's point, that literacy is not just rhetoric. It's not just what we're reading and taking in, but really what we understand it to be, and our level of presence consistently in what am I putting in my mouth that is feeding the quality of my energy, that is giving me the energy that I need, that is enabling me to be open, to collaborate with others, partner with others, to be open to problem solving through a process of emergence. We need to be emerging out of a plan, as opposed to we're spending hours and hours and hours with numbers and data and plans. But how often do we ever really achieve those plans, which is wasted time and effort? So magic wand for me, can we all wake up and then stay awake? Because the pandemic was predicted. We're going to have another one. Dr. Tedros on Friday said, maybe another 2 years this pandemic will end. And we've now got Ebola that's starting to surface again. So what are we going to be doing between now and quite possibly over the next 2 years? I certainly hope that we're not going to be seeing increased retrenchments, because that's going to mean more people are pushed into poverty. There we're going to see increased anxiety and depression. My wish is that really leaders are going to start taking care of themselves, getting the sleep, but then also reaching out and participating with one another.
Right, yes. And what would be your deepest wish, Christine, in regards to what would you, and you are, again, as an expert of health literacy, and you've been involved so many years, and you've seen so many things really occurring on the public health and global health arena, what it is that countries or perhaps politicians, for better or for worse, what are they doing that's wrong? Because this is not getting particularly better. And if there are, in fact, second waves or third waves or no waves at all, whatever the future brings, are we really prepared for the next? What do you think?
I don't think we are being prepared right now for the next, but we will probably be. We have seen some countries who are really well prepared because they have been through some emergencies like this. You have Ebola in Africa, but there the infrastructure is quite weak. But we had other countries like Taiwan that it was like pushing a button when they realized there was this virus going on in Wuhan. They closed their borders. They started producing masks. They had health information programs every evening because they know how important health literacy is. So health literacy is a strategy there from the day one. They ask people to wear masks, and many people are used to wearing masks after SARS. So that was not a new thing. They didn't have to be convinced whether it was right or wrong. They just do it, and they prolonged the Chinese holiday or the Chinese New Year holiday for some weeks. But after that, they have pretty much had a normal day. They wash hands much more, keep distance, wearing masks, and they have really low numbers. So there was a political action, but also willingness among people to help and support the initiative because they saw the impact of SARS. We know now that was the other thing. It was a shock, right, in February, March when the pandemic started, and we didn't know what it was. So we also saw politicians who really just shut down countries and no flights, and it had a really tough impact. Whereas now, 6, 8 months later, we know what it is. Our systems have geared up to manage the disease. So it's a learning exercise. And in that sense, I think in the future, what is most important is that we are flexible and that we are able to learn and de-learn and relearn, because the information will keep changing and the threats will keep changing, and the added complexity, as you say, Michelle, that will still be there, and the uncertainties will still be there. So we need to adapt to the complex times here and the time of uncertainty and be able to manage it in a way where we're not getting corona stressed or stressed in any other ways, but really just try to deal with it on a day-to-day basis. But it takes also the challenge of having our decision makers in line and that they know what is right. And you can argue that a few people in this world would also have to learn some health literacy, because we see a lot of messages from high levels on Twitter, and they create more confusion than actually certainty. So it's not only health literacy, it's also health literacy we can look at.
Very good point. So, in a way, what you are proposing here is to have a health literacy, but also the capacity to carry out a healthy critique. And this is something that, of course, requires a certain pre-existing knowledge in a way, which is not exactly something that you would find necessarily amongst everyone. Additionally, the comment is there's another comment here that says, well, not everybody has access to a computer. Nobody is not everyone is let's say illiterate or able or comfortable even to switching onto telehealth, which is the other way of connecting with doctors or healthcare practitioners and in this time. So there are some really staggering figures about people who are refusing or not going or attending to medical appointments or specialist appointments, who are just worried that by attending to hospitals they may in fact not ever leave or contract some significant disease such as coronavirus, for example, and come out of it anymore. So how can we, in terms of health literacy, yes, we looked at the top level, I suppose, would be a health literacy that engages people with critique and understanding and assertiveness. But on the other end, we have people who have absolutely no connections. I mean, they don't have facilities, abilities, money, even, like I said, technology to be able to access the basics. So really, how moving forward again for the present, certainly, but certainly for the future as well. How do you see, Christine, where are we going towards? Is the health literacy also changing in order to perhaps pick up and not leave anybody behind? Maybe e-literacy, is any programs or practices that governments are embracing in regards to improving that knowledge?
Yeah. We first of all have to be alert to the fact that there are some hard to reach groups that are particularly vulnerable and carry not only the health literacy burden, but often they have poor economy, poor health, and poor health literacy. So it doesn't make it easy. And when we try to provide information to them on how they can help themselves, they are dealing with so many other matters in their lives that health is not their first priority. It's about getting to work, earning money to make a sustainable living. And we do see here during the pandemic that those who suffer most are also those with a low paid job, because they are not the people who have good agreements with their employers or who have union agreements, but those who have to show up at work, can be bus drivers or people in the service sector that cannot afford to stay home. And this is the fact we see in South America, I guess in Africa too, and that makes the disease spreading much faster in those population groups. They also are the ones who cannot afford big houses or live in areas with a lot of, distance to other neighbors. So a lot of structural aspects influence that the disease is spreading much faster in their area. So we have to do much more to help them, support them, that they are not so vulnerable as the rest.
Mm-hmm. Michelle, comments from you? Michelle, we can't hear you. Sorry, you probably. Yeah.
Oh, there we go. I think technology is playing a big role in terms of telecommunications. We're seeing, particularly in Africa, everybody's got a cell phone. So we're seeing increased SMSs start to go out, and just, building on what Christine was saying in terms of a whole of government approach, that health literacy has to actually become strategic in terms of government's plans, has certainly been heightened by the pandemic. So Dr. Govender out in KwaZulu-Natal, he's got a lot of years working with government now, set up rural clinics in KZN that are a nurse-driven model, and he provides remote support to the clinics around the different areas, but it's then channeled via the nurses as well. So we're seeing a combination of human intervention, kind of pass the message along from one individual to the next, community engagement, and certainly lots of use of telecommunications, SMSs. So I don't think it's not that we're trying. I just think certainly what the pandemic has highlighted is that we need to be prototyping a lot more in terms of figuring out what's the best way, most effective way to create a hybrid model where health literacy is not just empty rhetoric, but that really it's empowering individuals, empowering communities, so that they can be responsible not just for themselves, but in how they're responsible for others by the choices they make in their communities in response to the pandemic today and into the future.
That's a very good point. Absolutely. So how soon should we start introducing health literacy? Let's say in schools with children. I mean, we know that there are some amazing, great initiatives in some schools, especially this part of the world. I know for a fact where there are meditation classes for children in primary schools, right? Something that was never ever before for introducing mindfulness, etc. So, how early is early? Is it too early to start with self-management and understanding of perhaps social responsibility, meaning translating into a health literacy, that is? early in the primary school children amongst them?
I think you can start even earlier. If we start in kindergarten, for example, I can recall from my own children. I have two teenage sons now, but when they were small and went to kindergarten, we introduced a washing hand program, and just by introducing singing when they were washing hands and doing it much more and much more regularly, and asking parents to wash hands before and after they came into the kindergarten, we actually lowered the numbers of disease days, or where the children were ill, but also where staff was ill. So that was also an increasing quality while they were there, and we could probably see the same in schools. And that will be interesting here during the pandemic. What other kind of illnesses will we see, a decrease in while we try to fight the pandemic? If I had to wish, I would love to see a subject on health and well-being in schools, like you had geography and math and language and so on. Why don't we have that? At this point in time, in most curricular, it's spread all over and project-based, and not all teachers are comfortable teaching those kind of projects. If we had a subject in place where all these things can be discussed at an appropriate age, and also integrating stakeholders from local communities and civic society, NGOs working with specific topics, I think that could strengthen both the school and the children and parents and the staff, the teachers, but also the local community. So I can't wait to see that reform. It's kind of a radical change to say, Michelle, right? That we need to reform the way we think in order to also match the challenges waiting ahead of us in the future.
I love that idea of a school subject. Please, can you give me the curriculum so I can approach the school my kids are at? I think for me, I'm quite lucky because I have a lot of people who are in this space, so they're always educating me. So I'm transferring the skills. So I'll play games with my kids. I'm like, okay, you want to load yourself up with sugar? Fine, load yourself up, and then let's time it and tell me how is your body feeling and how you're reacting. And we do things like presencing and mindfulness. So they're very aware. But to your point, not everybody has access or knows what to teach or how to teach. But it definitely is an important, critical need for kids to start as young as possible. And I love the idea of making it a school subject. Why wait until we start biology and start learning about mitochondria and cells and the impact of nutrients and food? We must start younger.
Exactly. And perhaps we could have a similar type of engaging learning activities also for other groups. For example, it could be for, let's call it for elderly, for instance, who are also especially subjected to significant issues as we know, and really prevention, it is absolutely better than cure. But if we do prevention, taking away all the misinformations and some far-fetched issues, but really bringing it to simple things, simple steps. In other words, embracing wellness before it becomes, difficult to catch up with, it would be great. So perhaps, what do you think, Christy? Maybe creating positive, engaging, and really powerful programs of the kind that are maybe tailored to different sections of society could be really perhaps the way to reach people, but also taking away the fear, right? Making it as an empowering, beautiful thing. I mean, if we think about wellness or program for wellness, we don't think about fear or, oh goodness, or I don't know, perhaps withdrawing from these kind of things. Everyone wants wellness. I mean, I never met anyone who would want not to have wellness in their lives. So if we marry health literacy with wellness programs as a prevention from the current issue and maybe future issues, possibly we may just get somewhere with that. Mm-hmm. What do you think, Janice?
I think we should definitely tap into lifelong learning. And there's been the strategies previously about, giving a man a fish and you give him food for a day. But if we teach him to fish, he can feed himself and his family. And I see a lot of openness from people to buy online courses, and when there are problems, they would try to learn about it. It could be mental health issues, or if they get a disease like cancer or diabetes, there are many opportunities. I would love to hear your take, Michelle, on what do we do with those who can't afford those courses, or who cannot, buy into it because they are still too high level. We know that at least 1 in 3 have difficulties, and in many countries it's maybe 40% or 50% or 60% even. How do we design, offers or opportunities or programs to increase people's self care abilities that are built on plain language principles and clear language principles? What do you do?
So here is where train the trainer, I think, is very, very powerful, is really just identifying your community leaders, your individuals of influence, who are walking the talk. I think that's really important, is not just to train the trainer for somebody who is just, whoever, but really is exemplary and role models the behavior of well-being, and using those individuals to influence the well-being of others and to disseminate the information that not only they're using with themselves and for their family, but, so that they're really able to answer in plain language some of the more simpler questions, and potentially then to redirect them or plug them into a health circle or a coaching circle, and to reliable sources where they can access information. So local community health centers where there are posters and flyers, and maybe even to sign up for plain language artifacts that are being produced, to participate in the research and in the testing. So certainly from an insurance perspective, insurance is also very complicated. So one of the things we often like to do is, when we're designing plain language artifacts, is really to get a group of consumers together and get them to give feedback, give insights. Do you really understand what this means? So I think, and in that way, there's even a possibility to generate income for that particular individual. So there's ways of combining research and testing what you're creating in terms of plain language assets, as well as identifying who are the community leaders and what information can you equip them with from a primary healthcare perspective that can prevent so much of what is so simple from a clinician's perspective, if only we had the basic understanding and knowledge. So, kind of to build on what you were saying, what do we de-learn, what do we learn, and what do we relearn, I think is so important.
That's right. Yes, that's absolutely great points. So how do we regain trust then? Not only learning, but how do we gain trust? Because I think trust potential has never been particularly there between, in certain times. I guess there were some very good, clear directives during SARS, for example, like Christine mentioned earlier on. And also back in the 80s, in the 90s, when there were HIV/AIDS, so there were particular type of behaviors and campaigns, etc., to keep people from, in fact, contracting the disease. But right now, what's the most important thing right now is health behaviors. Really, it has to translate in such a way so that we can get over this coronavirus once and for all and continue on. Until there is a vaccine, that is. So in the meanwhile, because we don't really know when a vaccine is potentially going to be available to all, or available at all, really. So what do? We see people still really being quite elusive of, disregarding rules or guidelines, really. And then we have number rising, certainly in Australia, New Zealand right now, and some other countries as well. And yet people kind of losing faith somewhat, or losing trust. There's a bit of a discontent. This is it's a marathon, and has unfortunately affected people not only physically, but with isolation, job losses, financially. How can we gain the trust and say, look, no, you have to hang on a bit longer. We don't know when, how long, but you have to do this. How can we say to people to do that? And as we can see, the message is not really going through very much at the moment. People are sick of it, really, literally. What do you suggest if you were, at the table with the WHO, Christine, as you could very well be, and just give some clear hints or suggestions? What would you say to the world leader?
Yeah, I think we have to communicate in a way that makes sense to people, both making sense that they understand the actual messages, but also the content has to make sense. And we have to also distinguish between when were we in an emergency state, and we see still some countries who are in emergency state, then you put all in and you ask people to do whatever they can. But in countries where we have lower cases and it's going now towards a new normal, the means and the measures needs to also be adapted to that phase, so that we ensure that people are able to understand when are we now in a new normal, when are we have to put all in, and that means that we as professionals have to look in the mirror and see, are we doing it good enough? Instead of just pumping out more information, can we do something that is better information? Is it other types of pictograms? Is it more plain language? Should we translate this in not only translate text into 5 languages or 7 languages or 10 languages or 20 languages? Some countries are really good at it. In Canada, they have hotlines, that can service for hundreds of languages, where in my own country, we struggle to really have everything translated just to the major ethnic groups that are here in Denmark, and it's not so natural, and it comes too late. And now we see an increase in cases among specific ethnic groups, which could have been prevented. This is also not rocket science. These are things that we have known for a long time, and that are related not only to the coronavirus, but to the diabetes and cancer and non-communicable diseases as well. So we have to really dig deep now, I think, in our toolbox, use whatever we can to ensure that this makes sense to people, because when it makes sense, we get their trust and they know how to act, but they don't want to be patronized and told, and that there is a corona police, telling people what to do. Very few people like that. So we need to build on people power as well. If it makes sense to them, they will act most likely in a way that is for their own good and the public good.
Absolutely, so true. Do we have the Corona police in Africa?
Yes. Yes, we do. But I think building on what Christine was saying, the WHO have done a great job in terms of starting up that special advisory committee that's now looking at behavior and the psychological effects and the complexity of, what do we create? What do we need? And then I think on Wednesday, Dr. Tedros was talking about now recovered patients have now started a movement and have joined forces to share what are the long-term side effects. So I think that this is complex. I think that we need to continue to be in conversation with what's coming out of the WHO. So really go there as an initial source. I think leaders, government organizations, leaders of organizations need to really start looking at well-being programs, not once-off infectious, I'm going to make you feel good, and then tomorrow morning life goes on. But really, how does the health literacy play a role in the productivity and the regenerative capability of an organization, an entrepreneur, a government agency? I think we need to get back to basics when it comes to things like that.
Yes, indeed, absolutely. And Christine, and a question really for both of you that just come through to say, well, what if what's the future? Are we going to go back to a normal? Are we going to have a new normal? What's the new normal? And that gives us some doubts to people's times. You have to understand fear and cultural sensitivities and think of this kind. I don't know, well, how can health literacy help shape a future, really? Because that's, I believe strongly, and I know I am biased because I absolutely love all aspects of health literacy, but in general, how do you see the role of health literacy in shaping really what is going to be, let's call it a new normal?
Yeah. I think we are going in for a new normal. I think health literacy really has the potential now to show people that they have an active role to play in their own life and their health and safety and well-being of their own life and those that they love. We know from before Corona that low health literacy was actually attributed to 20% of the health budget in the UK. So people not showing up to appointments, people taking medicine wrongly, health professionals not communicating in a way that patients understood. So 20%, that's ran up to a lot of money. And we know with these, let's say, more simple approaches or simplified approaches, we can save lives, we can save time, we can save money. So let's use this as an opportunity for change and create better lives, create better services with a focus on quality. And that we are able to provide timely and relevant and appropriate services to what people need. So it means much more tailored services as well.
Mm-hmm. And Michelle, do you think, though, that these can actually practically occur in a 5-10 minutes visit to your local GP? I mean, is that possible? Where, if we are starting, if healthcare practitioners have the wonderful task to make it simpler, easier, more direct, and more, straightforward, really, in a sense. And that empowerment comes from, patient-centered model healthcare. Do you think the GPs are the people able to do that? Not able because they're not intellectually understanding. I think they do understand that, but do they have the time to do that? Who gets the job?
Yeah, I don't know if they've got the time. I mean, I think if you look at the ratio of doctors and specialists to population sizes and the need, there is a lot of pressure that's being placed on clinicians and healthcare workers. So I have a question around whether or not they can do that because of the pressure that they're under, the stress that they're facing, and increasingly more so. And I think that's where we need to start exploring other ways to equip community members. As Christine was talking around, providing online courses, having it be a subject in school. I think the pandemic has really said to us, this is a blank canvas. Antonio Guterres keeps saying nobody is safe until we're all safe. And I think now is really the time for us to start to realize the importance of health literacy actually in impacting the SDGs. It's almost like if we had to go back to the root cause of all of this, if we just had to be present in the world, know our place in the world, and participate in the world with that in mind, with health literacy being the tenet of how we operate and participate in the world, then the environment itself would sort itself out. That issues of equality and gender parity and clean energy, it would almost become a byproduct because we're very mindful and awake of everything that's going on in the world. So I think health literacy is being undervalued, and I don't think enough attention is being paid to what this could mean for societies, for individuals, for the transformation and in building circular economies around the world.
Mm-hmm. So true. Christine, a comment on that?
Yeah, I think health literacy is the foundation to democratize health and to strengthen the enlightenment. And we see again how difficult it is now with the new vaccine. And we know there is many people are really hesitant towards a vaccine because they forgot about many of the diseases that we have eradicated due to previous vaccines. But there is a strong anti-vax movement, and how can we, get in touch with those who are in doubt on what to do to make sure that they understand the function of the way that vaccines will help us. And if they choose not to take a vaccine, would they at least then do the other measures of keeping distance and wearing mask and doing better hygiene, because that helps on all the other diseases too. I think a warning we have and what we see now is that a lot of other research and treatments and so on have been jeopardized because of the corona agenda in hospitals, and that they had to be alert and on standby. But I think now it's the time, because we know the disease much more, to really level out now and balance the impact, so we get back on track, also solving all the other health issues that are still there with mental health and non-communicable diseases. Because now the corona is just one of many other diseases, and we know how to tackle it. It will take time, probably 2 years or more, and that means that we can prepare ourselves for this new normal.
Fantastic. So, concluding remarks, Michelle, just concluding this wonderful, and thank you so much for your great insight. Just maybe concluding maybe a view for the future as a founder of the Africans United, your tremendous work that you do in Africa. What's your wish, if you like, as we are not quite approaching the end of this year, but going towards a better second part of the year?
I just hope people don't forget. They don't forget what this pandemic has done, that we stay awake, that we stay healthy, that we really start looking at channels and avenues and individuals where we can empower ourselves with good health. Because I think once we can get that right, then we can contribute better into what the world needs right now.
Fantastic, great. And Christine, how would you like to just, like I say, maybe a wish or your conclusive remark? This is a wonderful conversation. It has to be repeated, and certainly the escalation of health literacy and in various ways in public health and to the highest level, I think it's just the way to go, in my opinion. What's your thoughts?
Following Michelle's advice as well, that we stand together with a global view on this, so that it's not about me first, but us first, right? That we ensure that the masks are distributed equally, that the vaccine, whenever it comes, will be distributed to those who are in need, and that we do not forget the groups that are hard to reach, but do our utmost to get everyone on board, so that we leave no one behind.
Absolutely. Well, I would like to thanks very much so for both of you for your lovely time. Thank you. And I would like to remind whoever is interested in listening or re-listening perhaps to this conversation, and maybe write comments or participate, that they can certainly log into a website that's www.whis.uk talks, and over there you will find inspiring videos, and this one is certainly be a very special one of a kind, I think. So once again, my thank you for your time, and we'll catch up soon. Take care. Thank you very much.